Good afternoon. My name is Thomas Cartwright, and I'm a third-year internal medicine resident with the University of Missouri Healthcare. I'll be presenting my quality improvement project, Increasing Advanced Care Planning in the Outpatient Setting. Advanced care planning is an important part of caring for patients with serious chronic illnesses. However, these conversations are often deferred until a patient is hospitalized with an acute illness. My colleagues and I noted that many times patients were presenting to our hospital in states of illness where they're no longer able to speak for themselves, and we were relying on surrogate decision makers to answer the difficult questions about code status or overall goals of care. This puts stress on families who have never talked about healthcare goals with their loved ones, but more importantly, when these conversations happen late, there's a risk that the care patients receive may not reflect their values or goals. We identified this as an opportunity for improvement at our internal medicine clinic. Our goal was to move these conversations upstream, to have them while patients are stable in the outpatient setting and able to meaningfully participate. Our aim is to increase the frequency of advanced care planning discussions and documentation in the outpatient setting for patients at increased risk of serious illness-related morbidity and mortality due to significant chronic medical conditions. To understand the problem, we looked at our baseline advanced care planning documentation. We reviewed the records for all outpatient physician visits at our clinic in 2025, 4,152 in total. Of these encounters, we identified only 6 advanced care planning notes. This demonstrated a substantial gap between the number of patients who could potentially benefit from advanced care planning and the frequency with which these conversations were actually being documented. With this information, we wanted to better understand why these conversations weren't happening. We conducted a pre-intervention survey of which we had 28 resident respondents. The survey demonstrated that our residents routinely cared for patients with significant chronic illness. On at least a weekly basis, 82% reported seeing patients who had heart failure with reduced ejection fraction. 71% saw patients with CKD stage 4 or end-stage renal disease. 72% saw patients with severe COPD, and 43% saw patients with some sort of metastatic malignancy. The patient population was clearly there. The two major barriers to advanced care planning documentation identified were comfort and time. 27% of residents cited lack of comfort with advanced care planning conversations as a deterrent, while 51% cited lack of time. This helped us to recognize that simply telling residents that advanced care planning is important wasn't going to be enough. We needed to address both the knowledge and the comfort of physicians, as well as the practical barriers to actually having and documenting these conversations. Our intervention, therefore, had several components. First, we developed targeted educational efforts addressing the barriers identified in the survey. We used the Serious Illness Conversation Guides from Ariadne Labs as our model to provide residents with a more structured approach to these discussions. Second, we developed a standardized advanced care planning documentation workflow within the electronic medical record, including streamlined templates and documentation tools. The goal was to make documentation easier and reduce the amount of time required. Third, we created dedicated clinic appointment slots specifically for advanced care planning conversations. This was an attempt to address the time constraint that residents had identified as one of their biggest barriers. Our preliminary results suggest that improving access alone may not be sufficient. After the educational intervention, we conducted a verbal survey of 14 third-year internal medicine residents. Despite having dedicated advanced care planning visits available, 71% reported that they still did not routinely complete advanced care planning documentation because they simply did not routinely think about having the conversation. This was important, as it suggests the primary challenge may not be in finding the time or providing the template. We also need to make ACP a routine part of how physicians think about outpatient care, similar to the way we routinely consider vaccinations, cancer screening, or chronic disease management. Based on these findings, our next step is to focus earlier in residency. We believe that introducing advanced care planning education to first-year residents early in their training may be particularly important. Our plan is to integrate the Serious Illness Conversation Guide early with the goal of improving comfort and, more importantly, establishing advanced care planning as a routine clinical habit that carries forward throughout residency. We are currently awaiting updated advanced care planning documentation numbers for 2026 both within and outside of our inclusion criteria. We also plan to formally review Fairview Internal Medicine advanced care planning documentation in January of 2027 to evaluate the overall impact of the educational intervention, particularly among new interns. Finally, we hope to expand this program beyond internal medicine to include family medicine and palliative care, allowing us to bring standardized advanced care planning education and workflows to additional primary care settings. Ultimately, this project demonstrated a significant gap in outpatient advanced care planning at our institution. Our residents routinely care for patients with serious chronic illnesses, but time, comfort, and perhaps most importantly, the habit of recognizing when advanced care planning should occur remain barriers. Our goal is not simply to increase the number of advanced care planning notes in the medical record. The larger goal is to make these conversations a routine part of outpatient medicine so that patients have the opportunity to communicate what matters most to them before a medical crisis occurs. Thank you.